Ladies and gentlemen, the journey for focus, clarity, and mental mastery is about to begin. Live from WSIC Studios on the shores of Lake Norman, the show that gives you the tools to think sharper, sleep deeper, manage stress, and unlock your full mental potential. This is Your Brain Matters. And now, with over 30 years of brain science, more than 70,000 brain analyses, bringing neuroscience to everyday life, here's your host, Dr. Tim Royer.
Hey, everybody. How y'all doing out there? Amy and I are here to Your Brain Matters. And you know what? Your brain matters, doesn't it, Amy?
It really does. All the time.
It's just crazy.
Yep.
We take it for granted, but it is the most important thing that we have. And we don't take care of it many times like we need to. We don't kind of look at it. We don't strengthen it. And we don't realize how much it matters to every person, every moment of our day. Our brain matters.
That's right. That's why we declared it the year of the brain.
You keep reminding me.
I know.
I need to get
2026, the year of the brain. And the whole reason we're doing this show is to help people understand that it really does matter. Your brain matters. So I hope we're getting it through.
Yes. And you know, if they don't get it, I think we're starting to get it.
We're getting it, for sure.
Then the year of the brain, proclaimed by Nurse Amy, Royer, and Doc, seconds that motion. It's the year of the brain.
Sure. Why not?
Let's go.
Let's do it.
So we've been up to some different business here. I recently got back from some lectures up in Michigan. Man, it was cold up there.
Very cold.
So cold. But it was great. We were at the Women's Expo and Health there at the DeVos Center. That was really fun. Great group. And then got to speak to a bunch of mental health professionals at the State of the Child event at DeVos at the Meyer Gardens. It was awesome.
Oh, that's a great facility.
Yeah, you remember being there?
I do. Took many kids to field trips there. So, and then you did a lecture there. So what did you tell everybody about the state of the child?
State of the child, that their child's brain matters. That's what I said. No, we really had a fun lecture. It was just a great time. I love talking to people, educating them. And then I just got back from a group here in Mooresville, a group of NASCAR drivers, talking to them today about their sleep. And that was really, really fun. They had some really great questions about sleep and sent them home with some hormone analysis to look at things like cortisol, which we've talked about before, and melatonin. And they were super fired up to improve their sleep. So it was kind of fun.
Great.
Yeah.
So you're saying that hormones affect sleep.
Yeah.
Man, that's impressive. And we're saying that hormones have something to do with brains.
Yes, they do.
So it's all connected.
It all comes together.
I'm also thinking you spoke to the Women's Expo, the State of the Child, and the NASCAR drivers.
What do they have in common?
What do they all have in common? You know?
Their brain matters.
Yep.
Yeah,
you
there we go.
I know. You think we're silly, but we really mean it. And we really actually live and kind of devote our lives to this concept that your brain matters.
Absolutely.
Yep.
Absolutely.
Yep.
Actually, our quote of the day, I'm going to start our brain quote today, is actually not from somebody that we ever knew.
Okay.
But this is actually from a guy by the name of William James. Do you know who William James is?
I do not.
He was a philosopher, one of the first kind of psychologists that came onto the scene.
Long ago?
Oh, yeah. We're talking, 130 years ago.
Okay. Good old Billy James.
So I didn't call Billy, but he has said this. So they just quoted this. So
let's go.
So his brain matters. He says, the greatest revolution of our generation is discovery that human beings, by changing the inner attitudes of their minds, can change the outer aspects of their lives. That's pretty cool, right?
Yeah.
Is that our brains and our minds and how we see things can actually change how we interact with the world around us and how we perceive the world around us. Isn't that cool?
Yeah. That is. Being, as you say frequently, no man steps in the same river twice, because the river is never the same and what does it go?
The man is not the same.
The man is not the same, and neither is
the river. Yeah, exactly.
river.
Yeah, that's not my quote. That's a famous Greek
No, it's
philosopher.
a famous quote. It always makes me think. But then that goes with this quote in that it's how you see
Yes.
your environment at that moment. Like there's never two exact same moments in that river.
No.
They're all different. So it really matters how you see it because, it really affects how you interpret it then and make decisions and move on.
Which has a lot to do with our new 3-part series, which is about depression, the great imposter.
Ooh, this is a very, very good. This is a very good place for us to go next.
Yes.
Because we just finished anxiety.
Yep.
Anxiety and depression, Doc, wouldn't you say that? I mean, the vast majority of all mental health issues are stemming from one or the other of those.
Yeah, it's estimated that 280 million people have depression.
Whoa,
280 million
that's...
people. And that we know that depression is the greatest cause of disability on the planet is depression.
Wow.
And you take the 30% of people that will experience anxiety in their lifetime, couple that with the depressed population, and you're getting upwards over 50% that in a lifetime are going to experience clinical components of this. Isn't that amazing?
Well,
I mean,
that is amazing. But if you start to if you put it in numbers and you start to think about people you know and walk alongside of, I mean, you do see that. Like if I think even our family, you know, we talked about our 4 kids and that we experienced various levels of anxiety. But we also have experienced various levels within our family of depressive experiences or thoughts at different levels. So like it will be interesting for you to unpack this to us because again, these are feelings that we all experience, but we need to learn more about how you measure it and how you understand what's going on inside your body. Yeah.
And so what we're going to do is just like before in the other 2 3-part episodes, we do 2 3-part episodes. We're going to have 3 episodes.
Okay.
This one is going to be, the first one's going to be misunderstood, is that depression hides itself and it's misunderstood. The next episode is how it's measured.
Okay.
And the third one is how we modify the brain. So we're going to start with kind of this imposter piece that the brain has, is that it hides itself in a lot of different things. And then we'll go into those other 2 parts. So when people typically think of the word depression, they think of like sadness, crying, withdrawal, lying in bed. But it's way broader than that. And sometimes it can hide itself in a lot of different things, you know?
Yeah. Let's have you explain that a little bit more because I've definitely learned a lot from when you explain the imposter part.
Right.
Like what does it look like?
Yeah, so through different stages of development, we might see it displayed in different ways. And like in childhood, we may see that as a child who's got stomach pain, but actually is expressing their emotions that way. In adolescence, we might see it as substance abuse, or it might not be depressed behavior, but it can be irritable, angry behavior. And then later in life, we might see poor job satisfaction. And we're going to dig into these further in the next segment. But it hides itself. It like wears a mask and hides behind all these other things.
That's fascinating.
Yep.
Welcome back, everyone. We are talking about Your Brain Matters.
Yeah.
And in relation to depression, which you are calling the great imposter. And I never knew anything about depression until I started being with you and hearing about things and listening to you unpack things. And it is extremely fascinating. One time you did a lecture about depression in elderly.
Yeah, yeah.
And I think my mouth was wide open during that time because I didn't know any of that stuff. So we're going to continue to unpack. Our first part of this 3-part series is about how it's misunderstood.
Yeah.
So I think it's super helpful to go over all the misunderstandings, because then we can erase, or, like those misunderstandings and get to what is really underneath it.
Yeah. And one of the big reasons that we want to find out, see these things and realize there might be a depressive episode under these things is because depression can become kind of a learned behavior, in that if you have a depressive episode where you actually fall into a mood disorder, depression, and it will eventually, over time, if something really negative doesn't happen, like, a suicide attempt or something like that, it will actually go into remission at some point. It has kind of like a course of time, 18 to 24 months. But the problem with it is the first time you have an episode, once you've had a full depressive episode, now your likelihood of having another depressive episode increases. So you have a 50% chance now of having another depressive episode. It's like it wants to repeat itself. And that may come on 10 years later, right? But now once you've had 2 of those, then you have a 90% chance that you will have a third depressive episode. So it's very important, especially in children and adolescents, that you spot this thing that might be hiding behind social isolation, irritability, school problems, academic problems, anger outbursts, inappropriate behavior, substance abuse. Because a lot of times the substance abuse is trying to cover that up. And if you miss that and you don't successfully treat the depressive episode, it's not just that one moment in time, but it's the potential for that to keep repeating itself so that it becomes chronic depression over time.
Yeah, that's such a good point, because I feel like what you're saying is, in those imposter situations, is your body is experiencing depression, but it's trying to fix it on its own.
Yes.
So, I have so much respect for the human body trying to help itself, but it will often go in a bad direction with that.
Right.
Like, for example, easy to tell, the substance abuse is a bad direction. But if there is an underlying depressive episode going on, then it would make sense why you went after these substances, because you're trying to self-treat.
Exactly. And that self-treatment, that could go on for months or a couple of years. And the depression kind of goes away. But now you've gone through this first cycle. And so your chances are that you're going to have another one and get much higher.
Yeah.
Then it might come out of something else. Like all of a sudden you're not satisfied with your job, or you're putting on weight, or your sleep is really off. When you're starting to wake up too early and can't get back to sleep, in some indications that can be a sign of an underlying mood disorder going on. So, and so many times sleep is missed as far as how we use that to try to improve people with depression, because the sleep cycle gets off and the brain gets off. The brain gets off, the brain can't solve problems well. It gets stuck in this kind of learned helplessness model. Yep.
That makes a ton of sense, because we already talked so much about sleep and the value of the different stages of sleep, and how that REM sleep is what is really contributing to your mental health.
Big time.
So then if that's getting disrupted for whatever reason, and heaven only knows, in the adolescent stages, there's a lot going on.
Big time.
During the desired sleep hours, you think between 10 p.m. and 2 a.m. are our most desired sleep hours. And those are just completely destroyed in our culture with mostly the social media stuff and the access to the internet constant and things like that. Also, you'll see that in little kids, they have the awakenings at night and start having night terrors, things like that, that can really disrupt those really, really important times of sleep that you're talking about. And then you go to the old people and same thing. They're having disrupted sleep. So sleep is huge. Let's see. One other thing that you said is a phrase, meets criteria for major depression.
Yeah, I think that's very,
describe that, because I don't understand that in an easy way. I mean, maybe there isn't an easy way.
Yeah. So when we go back to the DSM, which is the Diagnostic and Statistical Manual for Mental Disorders, and here and there in the manual, you will see a whole section about mood disorders. And mood disorders, one of the mood disorders is major depression. Okay. And so there's some specific things about major depression that you will display behaviorally downstream, but the DSM doesn't actually have you look at physiologically things are going on and neurologically, which is what we do. But in the kind of classic diagnostic categories, there's different things about how you view yourself, how you view the world, your energy levels, your inability to complete day-to-day tasks, which fall into this major depression, which I think is very important to classify. Depression can come in different shapes and sizes. So there's major depression where an individual, their world just completely is just taken over with the depression. It's kind of, I liken it to a tidal wave.
Okay.
Where it takes them and knocks them off their feet. They can't get out of bed. The whole world is dark in through their eyes. But that isn't always how depression is displayed. There's another thing that's called dysthymia, which is more of a low-level depression that can go on for years, and that may come out physiologically in aches and pains and just mood and energy. You're still doing your job, and you're still functioning in life, but it's just like you're stuck in the mud all the time. And it's not the tidal wave. What it is you're standing on the beach and there's these 3 or 4 foot waves that are just pummeling you day in and day out. And you're still on your feet, but you're barely on your feet. And that's typically the ones, the dysthymia are the ones that really get unnoticed. And they're the ones that you just say, hey, come on, just, look at the world differently. And this person, it's everything's gray. They're seeing it all gray. Also in the mood disorders, you have bipolar disorder, which people are familiar with. And a part of bipolar is it will have a cycle that has this depressive component to it, right?
Yep.
So you have these different shapes and sizes of it, and it just can, especially in the dysthymia, it can hide itself in somewhat functional ways, but ultimately the person isn't enjoying life. They can't find the energy they need. They're having very negative thoughts over time. And those are the ones that we get concerned about, that those can just repeat to the point that it's just a lifetime of this depressive mood.
Yeah, I think about sometimes when someone is seeking help and when they're having these kind of feelings, and you might be able to say to them, oh, like maybe just get outside, walk 10,000 steps, like drink water, make sure you're not dehydrated, all these things. But that person might have no energy to actually go and do those interventions for themselves. To me, that is a sneaky way of seeing depression, is like, even if they want help, they don't have any energy to help themselves.
Right. Exactly.
So they're vulnerable in that space.
They're kind of weighed down by all of this stuff.
Yeah.
And it's very hard to see the world like they see it because they're just overwhelmed by it. But if we could see the world that way, we would realize, wow, this is very difficult. And sometimes we get a little glimpse of that when we look at the brain and we realize, so in the brain, we'll see a lot of electrical activity that's called low alpha, which are these low frequencies. Is similar to what happens in the brain when somebody smokes marijuana. Consequently, long-term use of marijuana does kind of lead to this depressive persona. And that's primarily because of these alpha waves that are 8 or 9 hertz. And when you look at what these low alphas do, they basically rob the brain of any creativity or innovation or plasticity.
Right.
The brain becomes very stuck. And people talk about that when they're depressed, they're stuck. But you can see the electrical current. Like I can hook somebody up, and in a 3-minute EEG, I can see some of these low alphas.
Yeah.
I'm like, wow, either you're smoking pot or you're probably having some type of depressive episode going on because your brain is kind of stuck. If I had that type of brain activity, I would feel that way too.
Yep.
Does that make sense?
Exactly.
It's not just, hey, have a good day today or pull yourself up by your bootstraps, right? there's more going on here that's electrical. And then also we'll talk about in the next segment about heart rate variability and heart coherence, and how when the heart gets very rigid, every little thing that we might adjust to and say, oh, that was okay. That guy just accidentally, got in my way when I was driving down the road, or this or that. The person with poor heart rate variability, everything is a crisis, which then leads to what we would refer to as learned helplessness,
right.
which is everything's overwhelming, and now I just want to give up.
Yeah.
I just want to quit.
Yeah. Cool. So you have explained that it is electrical in nature and it's biological in nature. So
Big time.
We'll talk more in the next segment about that.
Let's go.
Okay, welcome back. We are continuing a great discussion about depression and mostly how it is misunderstood, and just trying to learn more about how to recognize it, because if we don't recognize it, we may overlook it. As you said, it will come back and raise its ugly head.
Right.
It's kind of a learned behavior, and the more episodes we have, the more percentage that will happen again and again. In the last segment, you talked about depression being like a tidal wave.
Yes.
And then you talked about another kind of depression, dysthymia, being like small waves that just won't stop coming. And it reminded me. We failed to mention our giveaway for the month, which is our book called Tsunami.
Yes.
And as everyone knows, tsunami is a big wave. And we used the wave on the cover of the book because we felt that the diagnoses of anxiety and depression currently in our culture are like a tsunami.
Right.
It's a wave that's so big that we can't deal with it. And as mental health professional yourself, and as a wellness professional myself, we wanted to be able to throw some hope out there that there are ways to work with either of these diagnoses. But even when we were choosing the cover, I remember thinking with you that the depression and the waves is also another way to look at that cover. And that is that big wave that's coming at you. And there's this individual just staring it right in the face.
Right.
And then you think, well, what is that individual going to do, like, to avoid that wave? But anyway, that's all about the cover, which meant a lot to us because we were having to make a lot of choices about that. But we want anybody to have that.
Absolutely.
And we want to send that out for free. All you need to do is call or text the phone number, Doc.
616-341-2299. And we get you a free copy of the book.
Yes. We would love for anyone and everyone to read that. It is a lot of what we're talking about today, but it also carries a lot of hope with it, which is, what drives us is that there is hope. So we're going to move forward, and we're going into the segment of the show that we call Into the Mind, and we're going to go into the mind of Doc. He has worked in many, many settings and varieties of individuals that have dealt with and are dealing with depression. So we're going to go through 3 specific experiences that he's had, and we're going to just give him the chance to kind of unpack that. I hope you can sit back and enjoy listening, because his experiences just hold so much for us to learn from, because he was in the middle of it, and so he's been there, boots on the ground, and it's good to learn in that way versus just reading lots of books and listening to lots of people give advice. It's always good for me to hear somebody's actual experience.
Yeah, so let's talk about some of these early years in my career where I was involved with these different institutions. The first one, when I was a division chief at a large children's hospital in Michigan, part of my responsibilities were not just doing consults on kids and adolescents for physicians, but it was a teaching hospital. So we also had a lot of pediatricians that were doing their residency there. And so at a teaching hospital, you're educating, teaching. And so as the lead the head of the behavioral health department, I would come in and teach these young physicians, these young pediatricians. And I can always remember when I would come in and say, okay, we're going to talk about depression today, that it would be like, well, kids don't have depression. It was like, my first thing was kind of pull back the curtain and say, oh, you don't realize depression can hide itself in kids. Kids can get depressed. And we have to be looking for it because, again, we don't want this thing to repeat and us not realize that was going on, because it then increases its potential of repeating again. And so very early on, helping these doctors understand where to find this thing that was hiding. And then in a more extreme case, there were a few days a week that I would go, and we were in charge of the psychiatric assessments at the largest psychiatric facility on the west side of Michigan. And there I would come in because the psychiatrist would admit the patient in, but they wouldn't really know fully what kind of depression this was. Yes, they would go through the checklist. Yeah, you qualify. But really, where is this coming from? So, and is this depression with psychotic features? Is this bipolar? What is this? And because of my testing expertise that I've learned over the years, I would be able to come in and define that. But seeing some extremely severe cases, extremely severe, of childhood depression, sometimes brought on by PTSD, adolescent acting out, severe behavior that underneath was depression. And so experiencing that and seeing, wow, it can hide itself in so many ways, loss issues that contribute to that. And then the other area that was another place that I also worked during those years was another hospital, St. Mary's Hospital, where they had a psych med unit. And that means somebody's got medical issues, but they also have psychiatric overlay. And as you can see, my expertise is more in assessing, diagnosing, figuring these things out. And so I'm in a totally different group now. It's not kids. It's 60, 70, 80, 90-year-olds coming in to assess what's going on in the brain. And, we would come in and they'd say, hey, can you do some neuropsych testing? Because clearly this person has dementia. Clearly they have dementia. And I'm like, well, we're not too sure until we do some testing. And we would do testing and we'd find out, oh my gosh, this person looks, smells, looks, feels, sounds, everything is like, this is dementia. But then we kind of unpack things and start to look at the psyche and we'd be like, this person's depressed. But it looks exactly like dementia. It looks exactly like Alzheimer's. And so then I would come back to the lead physician and say, hey, let's try to do some things to treat their depression before we kind of say, hey, let's start you on these Alzheimer meds or these dementia protocols. And sure enough, I'd come back 3 weeks later to follow up. And the person, hey, Dr. Royer, how you doing? It's good to see you. I'm like, you were just the guy that I thought 3 weeks ago had severe dementia. And you could see his face brighter, and it was totally different. So in all these settings, it was like depression was hiding in all these different things, from trauma to just normal childhood development to late in life disorders. And really coming in and being able to see it and address it was able to kind of stop this cascade effect, or in many cases, people going down the wrong road. Like especially I think at the psych hospital, it was a totally different course if the person had bipolar disorder versus depression with psychotic features. And really trying to differentiate that is super important.
Yeah, I'm just imagining, like, how do you differentiate that? Because you don't want to go down the wrong route with the treatment. You'll either be spinning your wheels and the depression will continue, or you'll be hitting the target. How would you take the diagnostic process and turn that into recommendations for treatment?
Yes, and so that is next week. You're jumping ahead of yourself, girl. That's how we measure it. And so we're going to look at next week.
Okay.
But one of the kind of teasers to that I do want to bring out
let's
is
tease it up.
Tease it a little bit. More recently, about 8 years ago, we did a study of people that were clinically depressed and had clinical anxiety. So they were answering everything just like you would, clinically depressed. And rather than work on medicine and counseling with them, we worked on improving their breathing and particularly heart rate variability, measuring the coherence, the resilience of their heart. And was fascinating, in 12 weeks, 81% of the depressed group went into the normal level by changing the physiology of their heart and their breathing. They moved out of the depressed category into normal with just teaching them heart rate variability, which had to do with breathing.
Okay, we're going to ask you a little more about that in the next segment.
Really?
Yep.
Okay, let's go. Well, we're back. It took a little bit longer to come back because after the last episode, Amy looked at her hair and said, I told her that her hair looked good. And she looked in her phone on her camera and she said, it doesn't look as good as you said that it looked. What do you think it looks like now?
I don't even care. So I said, is it okay? He said, yeah, like thumbs up. And then I looked and there was a lot of disarray.
You didn't think it was okay?
I thought it was not thumbs up.
Okay, so I've got to be more clear because when you ask me...
No, next time I'll just look myself. I won't ask you.
I thought it looked great.
Thank you. That's so nice
good,
of you.
But it wasn't what you were wanting. You were wanting. Okay.
Sometimes I imagine it differently.
Oh, okay. Okay. Gotcha.
Yeah.
Okay. Well, we digressed. So we are back.
Yep.
This is a very sobering topic, depression, but it's a very real topic. I mean, it affects 280 million people. It's estimated that globally we lose over $1 trillion of productivity in the workspace. People not being able to perform, losing their jobs, $1 trillion because of just depression alone. It's the greatest cause of disability that exists on the planet. And you think of a lot of different diseases and things out there. Depression is the real deal. And Amy, on being on the medical side, you would acknowledge how much mood and depression also goes hand in hand with different diseases and medical things and chronic pain and all kinds of stuff.
It's so connected.
Yeah.
Yeah. You can't separate those out.
Yeah, and it's very interesting. A lot of the work in the heart rate variability space, where we spend a lot of work, because studies of 16,000 people over 12 weeks show that you can have improvement in depression by 56% by working on your breathing and your heart coherence. Now, this is interesting because this was found kind of in a roundabout way. See, we've always known back since the 1940s that people with depression have a higher rate of cardiovascular problems, right? I mean, that's just kind of a common thing. On the psych floors, or psych units, it'd be like, okay, this person has a cardiovascular issue because they're depressed, right? And so that's always been kind of, we know that in depressed people. But in the early 2000s, some cardiologists started asking some questions, say, wait a minute, what came first? The chicken or the egg? Wow. Okay. Right. Was it the depression that caused, which we all assumed, the cardiovascular issues, or could it have been some cardiovascular issues that actually caused the depression? So this research linked kind of medicine with psychology, right?
Yeah.
Which is, usually those two have been kind of in a different space.
Yeah. Yeah. And we've encouraged people to do breathing because we're brain people. And we've said, we want oxygen to your brain and then your brain will do better. That is true.
Right.
But that is not all that's happening with the breathing. And when we say the breathing, we're talking about the breathing that we talked about on this show.
Diaphragmatic
where
breathing.
People learn to use diaphragmatic breathing, the biomechanics, and the consistency of that actually impacts something called the vagus nerve.
Oh, boy.
And here is where the connection between depression and cardiovascular health is made, is really the vagus nerve.
Right. So you've got this nerve. You want me to talk about the vagus nerve?
I would love it. That was sort of my segue in for
you were tossing me that.
Yes.
Okay, that was like,
There you go.
here is a big
carrot.
grapefruit. Just hit that thing.
Yeah.
So the vagus nerve, I love the vagus nerve. It's my new favorite
loves
topic.
the vagus nerve.
Isn't it my new favorite topic?
It is.
It's awesome. So the vagus nerve starts in your brain and it interfaces with every organ in your body. And its job is to kind of keep the superhighway of your body all in line. It's kind of like a policeman that's keeping everybody going the speed limit. So a good example is if your vagus nerve isn't doing its job, that's 200,000 nerve fibers in your vagus nerve, 200,000. If they're not doing their job, then the heart doesn't function very well. So we work with a lot of neurodegenerative diseases, and we'll see that these people have much higher heart rates. Why are they having higher heart rates? Not so much because of the cardiovascular issue, but because the vagus nerve isn't doing its job. So without the vagus nerve, your heart would beat around 105 to 110 beats a minute. But through strengthening your vagus nerve, strengthening your heart rate variability, your physical functioning, you can get your heart down to 60, 55, 50, very low. Is it your heart that's doing that? No, it's actually the vagus nerve's strength that's making the heart do that. But the vagus nerve, when it's doing its job, you're able to stay out of inflammatory states, anxiety states, and stress states. So we're back to sympathetic, parasympathetic,
Yes.
right?
Yep.
So a non-functioning vagus nerve, which is totally dependent on the breathing, the diaphragmatic breathing, leads to an inflamed, overstressed nervous system, which over time, that leads to chronic fatigue, adrenal fatigue, and ultimately depression. So we can get back to, well, physiologically, this isn't just like, oh, I woke up this morning and I'm depressed, but there's something going on physiologically. And one of the major reasons that sleep gets so closely tied to this is because vagus nerve is also involved in sleep and recovery. It's all connected.
Right. It's so connected. And the vagus nerve is so connected to the gut and
Big time.
digestion.
Yeah.
There's so many fibers that wrap around all your digestive organs. So it is included in there. And that is why depression is generally coupled with digestive issues.
Yes. And that's, again, connected back to this whole loop of the breathing and the heart.
Yep.
And so this work of these cardiologists who said, hey, if we improved cardiovascular functioning by improving the vagus nerve and what's called heart coherence, which is the oxygen's coming in such a consistent rate that the heart is able to get into this ideal state of balance or homeostasis, then we do that, what happens to the depressive symptoms the person experiences? So when that happens and you develop heart coherence, you develop more resilience or more bandwidth. So think of it like a rubber band. Okay, so low heart coherence, which comes from poor breathing, poor vagus control, is like a really tight rubber band, okay? And really good heart coherence is like this expansive rubber band that can expand. So then think of stress and things you experience in your life. You don't have much capacity with that tight rubber band. And things like your kids spilling their milk at the breakfast table set you off for the entire day. Why? Because your rubber band is so tight because the heart coherence, the physiology isn't adaptable.
Yeah. And that's fine about the milk spilling one day a week, but with depression, that's how everything feels.
Everything. Yep.
It's
Even
just milk spilling to the point where you feel hopeless or learned helpless.
it's like this, you're have this obsessive rumination of these negative things, and you cannot get out of the cycle. Some of that goes back to that alpha activity. You've lost some of the creativity, okay?
Yep.
And some of it is this, in the learned helplessness studies in animals, what would happen is these animals would get a warning before somebody shocked the cage, okay? And so the animals would jump whenever they saw this light, or they'd try to avoid the bottom of the cage, the floor of the cage being shocked. And they became very anxious, these animals, very anticipatory anxiety. But you know what happened if you kept shocking the cage without any like predictable pattern? The animal would just start to lie down in the cage and just lay there and let you shock it. And that is called learned helplessness, which is what is depression. Is you get to this point where at first it's this anxiousness, this anticipatory worry. It's this on fire all the time. So this sympathetic inflamed response. But then the body can't keep up with it, and so then it crashes. And it's that crash or that swing that contributes to this learned helplessness or depression.
Got it. Okay. So we're getting down to the 2-minute drill.
Yeah.
And since we've been just talking about this breathing, this is the 2-minute drill today.
Yeah.
I know we've talked about it already. We've recommended it already. We've, unpacked it, but let's just do it.
Right.
Let's just do this breathing. So you can go on YouTube and you can just look for a 6 breath per minute pacer.
Yeah.
Super easy. Find one you like. There's kid-friendly ones. Do it with your kids. I did it with my mom and dad. We would just find something that was visual that we could follow, and we just breathe together. And you want to be able to do 3 to 5 minutes, but since it's a 2-minute drill, at least do 2 minutes.
I think 2 minutes.
2 minutes, and Doc would do 2 minutes 3 times a day because you want to catch it in the morning, middle of the day, and as you're going to sleep. But get good at this breathing. And honestly, if your vagus nerve is not working well, this will change it.
Yes, it will.
This will change your vagal tone, as they say, and move it from being weak to strong over time. Now, really good breathers can breathe in a coherent way for 20 minutes at a time, no problem. And that's where you really gain ground on the vagus nerve. But you got to start somewhere. So let's get this 2-minute drill going. Let's commit to this. Set an alarm on your phone to do it. And let's get breathing.
Yeah, we'll do, and when you wake up in the middle of the night, do the breathing. When you start your day, do the breathing. Middle of the day, do it. Let's go.